Hello, this is Dr. Juan Bautista. I'm an integrative medicine doctor. How do I treat low testosterone in the office? Guys, this is the most common reason why men see me in the office. Not because of their high cholesterol or their high blood pressure or their diabetes, but it's because they're having fatigue, they're feeling depressed, they're not feeling strong, they're feeling weak, and they want everything to be checked, especially their hormones, specifically testosterone. Of course, there's other hormones that I check to have a full panel, but testosterone is their main concern. So what is low testosterone? Low testosterone is a level of less than 300, but to step back, a normal testosterone level is between 300 to 1000. So deficiency is less than 300. There's also a difference between deficiency and optimization. So I hear it a lot, and it's a big discussion with my patients. But when I don't treat them because they don't have low testosterone, they get antsy about not being treated because they want their hormones to be actually optimized with testosterone replacement. So what is the optimal level? The optimal level is the upper 1/3 of the normal value, which is between 700 to 1000 or 600 to 900. And my principle is, if you want your testosterone to be optimized, I want it to be in the most natural way possible without adding any hormone replacement therapy. And what are the natural ways? Number one, I focus on is exercise. When you exercise, you actually increase testosterone, not the other way around. You don't want to take testosterone to be able to exercise unless you are deficient, which is called hypogonadism. But if you're not deficient, let's say your hormone level is 400, then you actually want to exercise. For example, weight training will be the most effective way to increase your testosterone to even at least 100 points. Number two is sleep. Sleep, among anything, is very important to have normal hormone values. Number three is nutrition. So nutrition, again, is very, very important. If you have poor nutrition, you're gaining weight, you have a lot of fats around your body, remember this: the fats in your body, in your peripheral tissue, the tissue on your belly, on your arms, that fatty tissue will create estrogen that will counterbalance your testosterone, so you will have low testosterone. So that's why you want to maintain a healthy weight. And there's also an argument about, why can't you give me hormones? When I tried testosterone, I felt great. Remember, hormones are very powerful. These are small chemicals that will induce a big chemical reaction in your body. When you were as a teenager, there's a lot of hormonal changes. You can really feel the power of your hormones. You can be rebellious, you can feel strong, you feel that you're smarter than your parents. When someone or a woman is menopausal, they can really feel a change. It's a big change. That's why hormones are very powerful. And even if you're not deficient, if you would supplement or enhance with testosterone, you will really feel a difference. So it doesn't matter even if you have normal values for testosterone. If you take testosterone, of course you will feel great. Same thing with women. If you have estrogen, even if you're not estrogen deficient, you will also feel great. The take home is, you can do this in a more natural way, how the body wants you to be. Okay, if you like this content, please follow us. Bye.